2 weeks to your periods, but you are experiencing breast pain. 2 weeks to periods, you are experiencing breast pain. You are remaining with 2 weeks to see your periods. You are experiencing breast pain. You are having lots of breast pain, and you are asking yourself, is it normal? When a woman is about to see her periods, normally there are changes that are going to take place. On this channel, Omusau Gerald Massa, I do discuss fertility issues. I'm a fertility educator. I will answer all your questions. Ask me your questions in the comments below. I will be able to answer you. So our friend Taladi has asked a question just over here. She's saying she is actually experiencing breast pain. She normally experiences breast pain when it is 2 weeks to her periods. What is the cause of this? When you are about to see your periods, there are going to be changes. There are changes that are going to take place. These changes are going to actually be in relation to your hormones. Hormonal changes take place when you are about to see your periods. These hormonal changes are due to the fact that if you did actually get pregnant, if you got pregnant, then there's going to be a rise in two hormones. Specifically, this is what we call progesterone hormone, and then of course also estrogen. So if you get pregnant, that is on the ovulation time, the ovulation period, you get pregnant, you are going to actually experience a rise in a hormone known as progesterone. This is normal. Why? Because when you get pregnant, there needs to be a high level of progesterone hormone, which will actually support the whole process of implantation. And remember, implantation is the attachment of the embryo onto the wall of your uterus. So this hormone known as progesterone, it supports the growth of the embryo. Remember, if a woman has low levels of the progesterone hormone, there's going to be a high chance or a high risk whereby the pregnancy may end in a miscarriage. Remember, a miscarriage is pregnancy loss before 20 weeks. So if a woman has enough progesterone hormonal levels, the pregnancy is most likely going to proceed up to term, up to 9 months. So when progesterone hormone is pouring in your system, estrogen hormone is also pouring in your system. FSH and LH hormones were actually, specifically FSH has reduced because you would have passed already the follicular phase of your cycle. And then of course also the LH hormone would also have actually done its part. Remember, LH hormone is responsible for ovulation. Now, the changes in these hormones, that is FSH, LH, estrogen and progesterone, and then of course also prolactin exerting a negative feedback on your hypothalamus, there's going to be actually changes in your body as a woman. So if you are experiencing breast pain and it is only 2 weeks to your periods, the breast pain most likely could be due to hormonal imbalances or hormonal changes. And remember, you don't need to worry about this. This is a normal occurrence. It's a normal experience which actually many women get. So if you are experiencing breast pain 2 weeks to your periods, it's normal. You don't need to worry. It could be due to hormones. But remember, if you are a young girl and you are in your puberty time, or you are in puberty, then also this is also going to be actually happening. You don't need to worry about this. The other reason why you might be experiencing breast pain is that maybe if you got pregnant and still the hormones I've just talked about, that is progesterone and then of course estrogen, may actually begin to rise, and still this may be due to hormones, just as I had said. The other thing why you might be experiencing breast pain, even if it is 2 weeks to actually your periods, could be that maybe there's something abnormal. Okay? How can you tell that there could be something abnormal? You actually need to go to hospital. You need to go to a hospital near you, and then your doctors will do some checkups. The doctor might decide to do what we call a breast ultrasound scan. And in many cases, the breast ultrasound scan will give clear pictures of how your breasts are. Remember, you did not pinpoint the exact area of the pain, okay? You did not specify whether it is on the right side of the breast or the left side of the breast, or it is in both your breasts, okay? But when you do the ultrasound scan, the breast ultrasound scan, it will be able actually to analyze and show clear pictures of your breasts and specify what could be causing the breast pain. There's a condition known as fibrocystic masses, okay? Fibrocystic masses, or simply cystic masses. Remember, a cyst is a fluid-filled mass, okay? It's a swelling which is actually filled up with fluid. So if the ultrasound scan shows that you are having swellings in your breast and these swellings are filled up with fluid, then your doctor will make a report specifying that you have what we call fibrocystic disease, breast fibrocystic disease, or simply you have breast cysts. And then, of course, your doctor, the one who has just done the ultrasound scan, will be able to pinpoint at which exact point the swelling is at, okay? Whether it is at the upper part or at the lower part, or it's at the sides of your breasts. So remember, if you are experiencing breast pain and the pain is really too much, you have tried to wait for the periods, you've seen the periods, but the breast pain is just increasing. And maybe there could also be changes in the color of your breast, and maybe the shape of your breasts are changing. You as a woman, the nipple, you know exactly the exact position where the nipple, your nipples are supposed to actually point, because you examine yourself in the mirror after you've taken a bath or after bathing. So if you experience breast pain and then you examine yourself, you do what we call a breast self-examination, whereby if this is the nipple of your breast, you put the whole of your hand and then you actually begin massaging. Breast self-examination, you can actually talk to your doctor nearby. They will show you how to do the breast self-examination. So if at all you do the breast self-examination and then it shows that there's actually something not right, maybe the shape of your breast is actually changing, the nipple is facing in another part or in another direction, which is actually abnormal, and then maybe the breast is changing in its color, it's actually becoming more brownish, it's actually becoming like a ripe orange or a ripe mango. This is actually a warning sign. It's a warning sign whereby it could actually be signs of maybe breast malignancy or breast cancer. So you need to go to hospital, and then your doctor will do a thorough checkup on you, whereby they will do what we call a mammogram, X-ray of your breasts, and then of course other tests will be recommended according to how your doctor decides. So if you are experiencing breast pain and you are remaining with 2 weeks to see your periods, be patient. You could actually get some over-the-counter painkillers, take them, and then of course you'll be able to actually feel much better. Your pharmacist, the doctor at the pharmacy, will be able to advise you on the best painkiller for you, okay? You need to go to a nearby pharmacy, and then your doctor will manage you. And then if at all the pain keeps increasing, you've seen your periods but the pain is increasing, and of course even the breast color is changing, then you need to go to hospital for a thorough checkup. Next point I'm going to discuss about is how can you, or how will your doctor give you the treatment. Of course, after confirming that it is maybe a cyst in the breast, or it is maybe a fibroadenoma, fibrous tissue forming in your breasts, or it is just a swelling known as an adenoma in your breasts, your doctor will decide whether to do a surgical procedure, an operation. For example, is an operation known as a subcutaneous mastectomy, or basically a mastectomy, but this has to be decided by your doctor, okay? This video is for education purposes only. It's just a video to notify you or to enlighten you on some things which could be happening to you, okay, to give you knowledge. But you need to go to hospital for a thorough checkup, okay, if you are not feeling fine. So if you have any questions, ask your questions in the comments. I'll be able to answer you. I could actually also do a video, just as I've done a video for Talade, replying her. Talade, thanks a lot for asking your question. Greetings, and if the pain increases, remember to go to hospital for a thorough checkup. Now, if you have issues you would like to get answers to, you would like to know how your husband can increase their sperm counts, how you can manage polycystic ovarian syndrome, how you can improve your ovarian reserves, how you can actually, which foods you're supposed to eat to get pregnant faster, just visit my website. It is just across here, omusawo geraldmassa.com on Google. Visit my website. Ano omuwala okuva lwe yazaalibwa mu nsi, wuno akuze, atuse ne mu bufumbo naye ng'ate tagendangako mu nsonga ze. Tamanyi kigambo periods kyeki, tamanyi kigambo pads kyeki, tazikozesangako, talabanga ku periods, ali kwebuuza kino kyaleetebwa ki, kiva ku ki, kisobola okujjanjabibwa oba nedda. Primary ovarian failure ly'erinnya eriweebwa condition eno oba embeera eno ey'okubanga omwana omuwala atuse n'okuba nga akuze naye nga talabanga ku periods ze. Tukimanyi bulungi nti omwana omuwala bw'aba abadde akyali mu lubuto olwa maama we ng'akyali mu abuuzizza ekibuuzo n'agamba nti omukyala bw'aba nga abadde ku family planning eya Depo Provera, eno empiso gye bakuba ku mukono ey'emyezi 3, family planning ey'emyezi 3, bw'aba nga abadde ali ku eyo family planning naye n'aba nga agimaliriza, agenda kuba afuna olubuto mu bbanga ki? Mu eno video ngenda kuddamu kino ekibuuzo. So family planning gye bayise Depo Provera eno ey'emyezi 3, ennaku zino bagiyita Sayana, waliwo ekika ekipya kye bayita Sayana. Omukyala bw'aba nga abadde ku family planning eyo ng'ali kwebuuza ddi lwagenda okuba nga afuna olubuto bw'aba nga abadde agimaliriza. Omukyala bw'amaliriza family planning eyo, katugeze yagimaliriza leero, eweddeko leero, ng'ali kwebuuza ddi lwagenda okuba nga addamu n'alaba nga asobola okufuna olubuto. Kiba kirungi nnyo n'asooka n'agumiikiriza n'alaba periods ze ez'omwezi oguddako. Wamala okulaba periods ze ez'omwezi oguddako, then awo aba asobola okuba nga ate akola kye bayise ovulation calculation oba okumonitoringa ovulation ye asobolera ddala okuba nga afuna olubuto. So the most important thing is okulaba nti amonitoringa ovulation ye ng'amaze okulaba periods ze. Bw'aba nga abadde yakava mu family planning mu eyo week, kiba kizibu okuba nga afuna olubuto kuba family planning eno eba ekyali mu mubiri gwe. So kansubire nti naawe gwe abadde yeebuuza kino ekibuuzo kye kimu nti oba omaliriza family planning eno eri hormonal, ojja kufuna ddi olubuto? Olina okugumiikiriza n'osooka n'olaba periods zo, and then mu bbanga erigenda okuddako oba mu weeks ezo ezigenda okuddako 2 okusinziira ku buwanvu obwa cycle yo, osobolera ddala okuba nga ofuna olubuto.